Thank you for joining us. At this time, I would like to introduce the key speaker today, Robert Ogilvie, who I've known for a couple of years now. Robert Ogilvie serves as the Vice President for Strategic Engagement at Change Lab Solutions. Over the past 15 years, he has worked extensively in community development and planning to help and improve low and middle income neighborhoods. Prior to joining Change Lab Solutions, Robert served as a faculty member in the Department of City and Regional Planning at the University of California, Berkeley, as a consultant to city and governments, nonprofit organizations, neighborhood activists, and as a director of volunteers at the Partnership for the Homeless in New York City. He is the author of Volunteerism, Community Life, and the American Ethic. Robert co-leads the California Convergence Joint Use Policy Task Force and is a member of the editorial board of Community Development, Journal of the Community Development Society. He is also a member of numerous organizations and committees, such as the National Advisory Committee of the Robert Wood Johnson Foundation. In addition to, he serves on the steering committee of the Strategic Alliance for Healthy Food, Active Environments. Robert is a member of the American Planning Association. Robert holds a PhD in political science from Columbia University and is a graduate of Queen's University in Kingston, Ontario, and the University of South Carolina. At this time, I'd like to introduce Robert Ogilvie.
Avtar, thank you very much. And thank you all for joining in this morning. If there's ever any problem hearing me, someone should please speak up. I'm here in Oakland. We get a lot of street noise coming in to our office, so you might hear ambulances going back and forth. I assure you that's perfectly normal, nothing for you to get worried about. I just want to, I think I'm the one who's in charge here of moving the slides forward. So you should see on your screen right now something about the chat function. And the chat function is how we can communicate with each other. We've got till 11:30 today. I'd be surprised if we go the whole way. We have a relatively small group of people on hand, and I would like this to be as interactive a webinar as possible. And so please use the chat function. In my screen, it shows up as a box in the lower left-hand corner, and I think it'll do the same for you. And there's a place that says type message here. And so I'm just typing in this is a message into that, and I'm going to select broadcast to all, and I just sent it. So you should see something from me saying this is a message. If you have questions for me, please type in there and hit broadcast to all. And what's going to happen is Livia Rojas here in my office will interrupt me as I'm presenting and read the question, and then I will answer it. So we should have a pretty good back and forth. I'm not going to be typing any more questions in there because I'm not capable of reading and presenting a webinar and typing questions and answering all at the same time. I failed that part of school. I'm sorry. So I'll just do the best that I can, but Livia will help out with that. So without further ado, thanks for the introduction, Dr. Avtar, and we're moving on. The title of today's talk is Comprehensive Planning for Active Communities. And active communities are, let me define an active community for you, and then I'll get into it. Active communities are something we had in the good old days. You know, I want to tell you how it was in the good old days. In the good old days, kids walked to school. You see that kid there carrying their lunch pail. I would ask you all to put up your hands to tell me how many of you walked to school when you were kids, but I know I walked to school, and I can remember very well in the second grade when I was now in charge of my younger sister who was in junior kindergarten who had to walk to school with me. And we probably walked, I don't know, we walked uphill for 15 miles through the snow both ways. No kidding, it wasn't as bad as that, but still it was about half a mile. And my parents felt perfectly safe, and it seemed perfectly normal at the time because everyone else was doing it, and that's just what we did. It probably took us 15 minutes to get to school if we were paying attention and not dawdling, and 15 minutes to get home. So that was half an hour of activity that was just built into our daily lives as kids. Nobody thought anything about it. That's just what we did. How else were we going to get to school? Adults walked to work. My dad didn't walk to work, but most of the adults in our neighborhood did. A lot of them took the bus. Those who live nearby walked to work as well. So for adults, activity was just part of their daily life. Our people just walked around town, walked to the corner store, walked to the newsstand. Remember newsstands? So much of what we did daily involved physical activity. Places were built so that public transit was a key way of getting around. City parks were crowded. City parks were the original reality TV show. Even as a kid, this picture was taken long before I was a kid, but still, the neighborhood park was a place where there was just a lot going on. And this was in part because my neighborhood and a lot of other neighborhoods in most American places, and when I say places, not just cities, because American towns were built the same way, was mixed use. And what mixed use is, I want to talk a little bit more about this. It's a type of zoning, a type of land use pattern where different uses of land, so residential, industrial, commercial, other sorts of institutional like schools and churches, could happen in the same place instead of single use, which is what we commonly have in a lot of places now, where there's one part of town that's strictly residential and another part of town that's strictly commercial, and never the twain shall meet. The advantage of mixed use in terms of physical activity is that the places you need to go every day are nearby to where you live. So they're within walking or cycling distance, so that physical activity is a realistic option for getting around every day. And there's still lots of places that look like that. This picture is in the French Quarter of New Orleans, but it's not only places like the French Quarter that look like this. But what is typical here, which is typical of many mixed-use neighborhoods, is you see commercial on the ground floor and residential above. And that has a lot of advantages for the residences. The residents, I've already spoken about the advantage of having the places you need to go within walking distance so you can get there easily. But it also has a lot of advantage for the businesses because their clientele is right there. Their clientele is built into the market. And slowly in a lot of places you're starting to see this construction pattern return. I'm going to talk a little bit later about some of the economic benefits of this construction pattern, but one of the economic benefits that a lot of towns in California and elsewhere are seeing right now is that this sort of development pattern has a mixed, robust, and resilient tax base. In the acre of land that you see here, you are collecting property tax, the city is. You are collecting sales tax. You're collecting business license fees. And as different sectors of the economy come and go, you aren't solely dependent as a city on one revenue source that might be prone to collapse. Moving along. It was the same for grocery stores. I'm sure most of you who are on the line, and I recognize a lot of your names. I don't recognize all of you, but you're probably familiar with the concept of the food desert. And a food desert is an affliction, really, in a lot of American places right now, where affordable, healthy food is not readily available within easy distance of people's residences. But it used to be the case that people walked to grocery stores. The drive-in market is a relatively new idea, and grocery stores were sprinkled around. They were smaller footprint than they tend to be now. And many city supermarkets didn't have parking lots because people lived just around the corner and they would walk over to do their shopping. But things have changed. It's become more difficult to be physically active today. And the large overarching reason for that is really starting around the end of the Second World War. There was a change in American planning and a change in building patterns of American cities. And cities started to be built around the car. If you didn't have an automobile, it became increasingly difficult to get around. And American city planning started to build places that really facilitated quick circulation by automobile. So here's an example of a typical suburb, anytown America, where you see different neighborhoods around the intersection of a big freeway. In the very bottom center of your screen is your typical residential neighborhood. Middle class, you can see, single family. They got a couple pools there. In the very left part of your screen where you see that track, that's a high school. In the very right part of your screen, you see the typical big parking lots of your suburban office parks. So you've got what you need right there. You've got residence, you've got work, you've got school. But the way you get to each of those is by car. You don't really get to those by walking. Walking was not really, or cycling was not really factored into the design of this place. And if people did any of those at all, it was sort of, as an after work or an after school recreation during their recreational time. But it certainly wasn't conceived of as the main way to get around to any of these places. And as you get into the suburbs now, as you get deeper into the neighborhoods, the street pattern, the cul-de-sac, I grew up on a cul-de-sac. Cul-de-sac was great fun for us, playing games and various things down at the bottom end of the keyhole here. But as a neighborhood where it was easy to get around to places other than your neighbors' houses on foot, the cul-de-sac really hampered that. The street connectivity that makes other places close and other places easy to get to was not valued here. Instead, privacy was valued. And so if you live in one of these houses in the middle here and you want to get somewhere where on foot or on bicycle, you've got to go through all these curving streets, and it makes the distances a lot more than as the crow flies. So it really has been found to discourage physical activity as a way of getting around. And then when you get to the commercial parts of town now, you get out of the cul-de-sac and you get to where you need to get, you're confronted with places like this. I'm sure all of us are very familiar with places like this. And as you see in the red circle, in the middle, there's a guy trying to cross the street. I don't know what he's doing there. Maybe his car broke down and he's going across the Chevron station to get some gas, because this is clearly not set up to be a place for anyone who is in anything other than a car. So that's become a typical spot. Here's a Southern California picture as well, where you've got kids here walking to school, really on the side of the road where parking takes place, certainly not a sidewalk. Certainly they are using the place here, but it was not built for them to walk to school. They were definitely an afterthought in places like this. And so this is the typical American environment. It's possible to make the healthy choice. Kids can walk to school. You can eat healthy food, but you really have to deliberate about it, and you have to be deliberate. And the healthy choice has, in effect, become the hard choice. I have heard others in the same line of work as myself say that American cities have been designed for disease. And I think that's a real powerful statement, and it's one that I agree with. People will make the choice that is easier. People will make the choice that is more convenient. And physical activity has become the difficult and inconvenient choice for people as part of their daily living. And so physical activity has declined. What I'm going to talk to you today about is how to retool the places that you live, and what are some of the tools that my organization, Change Lab Solutions, which by the way was formerly known as Public Health Law and Policy. Some of you might know us better that way. What are some of the tools we have to help you? And here's the big thing that we're looking at, okay? Percentage of adults getting recommended levels of physical activity. In a few states, it's above 70%. In many states, it's below 50%. And my belief about this slide actually is that the situation is much worse than it is, because this is self-reporting. Okay, this is not, these statistics don't come from people who are carrying pedometers so we can really see what they were doing. These come from self-report, and as we all know, people tend to self-report. They tend to exaggerate the things that they know they're supposed to be doing, and they tend to downplay the things that they know they're not supposed to be doing. But even in these self-reports, we've got huge chunks of American adults who are not getting anywhere near the recommended daily level of physical activity. So what can we do about that? So given the fact that places have been actively designed over the last couple decades to promote inactivity, I mean, that's the bad news, okay? The good news is that those same tools that have been used to create places where physical activity is the norm can be turned on their head and used to create places where activity becomes the norm. What we're looking at as a goal is what we call a complete neighborhood, okay? A neighborhood that works for everybody. Whether you're a senior citizen who can no longer drive, whether you're an 8-year-old who needs to get to school or the park, whether you're a working mom who needs places like grocery store and others close by, whether you're a single dad, on and on. The goal is a complete neighborhood where things are nearby, the things you need to do, the places you need to go are nearby, and you can get to them by different modes of transportation. You can drive if that's what's going to be most convenient. You know, certainly if you're going to the grocery store and stocking up for the week, you're not going to walk and schlep all that back home. But where you don't need to drive, if you don't want to. And I'm going to start with land use. Dying for someone to ask a question here. I see the chairperson has asked you all to use the chat box if you have any questions, so don't be shy. What you see here is your typical land use map. It's a zoning map, and it's got different colors that show the different uses in different parts of town. And this is a town in Michigan here. And I bet a lot of you have been involved in a plan update process somewhere in the Central Valley, somewhere in Kern County or elsewhere. The advantage and what the plan update process does is it enables you to put language in a general plan that impacts these different issues you see here, all right? So there are land use strategies that affect or can affect the mix of housing types and affordability in your town or in your neighborhood, that can affect access to neighborhood services, and that can affect access to public transportation. The general plan in California is the Constitution for local development. It outlines what is supposed to happen in the region over which the plan has jurisdiction. And so it's a fundamental place to start if you want to have an impact on what a place looks like. So we spoke earlier, or I spoke earlier, let me see if I can get this to move, about mixed use. If you want a place to be mixed use, or if you don't want a place to be mixed use, that gets enshrined in the general plan. The language dictating that gets written into the general plan. And there are different strategies for encouraging mixed use. Right now, one of the strategies that a lot of places are using is they favor infill development. Infill development, it's not a complicated term. It actually is exactly what it says, and what it means is it's a development that is filling in underused or vacant places within the already built up area. This has become the preferred strategy of the California Governor's Strategic Growth Council. It has become a strategy for enhancing walkability, for building up local tax bases. Towns all over California right now have decided that they can't afford to put in new infrastructure being roads, sewers, lights, those sorts of things that towns have to pay for. And what they want to do instead is make better use of the existing infrastructure and have more intensive land use in the places that are already built rather than sprawling or building out on the extremities. How do you facilitate infill development? One way is what they call a density bonus. These are bonuses that are given to developers for doing certain sorts of things. And if they agree to do certain sorts of things, for example, providing a public amenity, for example, kicking money into a fund to enhance recreation opportunities, paying for sidewalk improvements, lighting improvements, other sort of public amenities like that. They can be given bonuses. You can sweeten the pot to allow them to build a taller building, for example, than they might be allowed to otherwise. So there's a financial reward for them. This is one of the ways that a lot of places are using to incentivize mixed use and infill. And it's all done within certain urban design guidelines. Pedestrian access, bike parking, these are some of the things that people are really trying to ensure as they do the infill. The idea is not just to make a place more crowded and more hectic, but to make it more appealing and more useful for people to get around so that people will actually use it. And Livia Rojas in our office will be in the chat function posting links to some of our materials that will help explain some of these issues. And I know we've got bike parking ordinances and other pedestrian access ordinances, model ones that you can take and use in your town. So in St. Lucie County in Florida, their general plan has the following language enshrined in it. And it says that each neighborhood must contain a mixture of lot types to provide a variety of uses and diverse housing options within the neighborhood. So they've got single-family houses with yards within neighborhoods, but they also have multi-unit dwellings. This has become a big thing for grandparents who, can't maintain or don't want their single-family home anymore, but still want to be living near the grandkids. In neighborhoods where you only have one housing type and one lot type and one housing option type, people are being forced to move. What they're finding in St. Lucie County and others is if you have a variety of housing options, you can maintain a diversity within the neighborhood. And they say each neighborhood must contain at least one mixed-use or retail building lot, so that they've got retail, the neighborhood mall, the neighborhood shopping center to service the neighborhood. Transportation is equally critical. All right, I've already spoken a bit and showed you some of those slides of neighborhoods that are just designed for automobile. And if you take a look now down in the chat function, you see a couple links that have been put up there. One for the California bike parking ordinance and some comprehensive language for complete streets to go into general plans. Thank you, Livia. So I think this picture is Fresno. Maybe someone correct me if I'm wrong. But
it is Fresno, Robert.
It is Fresno? Woohoo!
Yeah,
Thank
because
you, Avatar.
FACTS is Fresno area, I think, transportation, so yeah.
Okay. Transportation options are critical. You know, I live in San Francisco, and San Francisco has decided that it's going to be a transit-first city. They want to get people out of their cars, and they want to get people moving around via transit. The problem is our transit system is a mess, and that is endlessly frustrating to people, even to people like myself who are true believers in this. And so a functioning transportation system that works for people is critical if you're going to implement mixed use and walkability. The medical research shows definitively that people who take transit way less, that physical activity is more a part of their daily life. This study says that 1/3 of Americans who commute to work via public transit meet their daily requirements by physical activity by walking as part of their daily life, walking to and from the bus, from home to the bus, from the bus to work, to the shopping mall. It's just built in, okay? But the only way people are going to do this on a daily basis is for the transit system to work, for the transit system to function. And for it to function, there's got to be adequate resources. And one of the keys for there to be adequate resources is that the places you live and the places you need to go to need to be within walking distance of a transit stop. And there need to be plenty of them, and there need to be plenty of people using the transit system. So that all speaks to density. So strategies for an efficient transportation system. There needs to be what is called multi-modal infrastructure. Infrastructure, roads, tracks, stations, access points that allow people to switch easily between modes. So if you're going to drive your car, you need to have somewhere to park so you can get out, so you can get on the train or something like that. And then that train needs to take you to a bus, and there needs to be a seamless transfer if you need to take the bus to get somewhere. That is still a rarity in many American places. Moving from one mode to another is still difficult. And that discourages people from using transit. Need to be a destination network. The range of destinations, the range of places people need to go, work, school, shopping, home, church, entertainment, hospital, whatever else, they need to be connected to transit. Okay? Otherwise, transit's not a feasible option. And there needs to be equitable access. That's a big issue in some areas because the transit system has been built in such a way. Take the case of BART in the Bay Area. BART was really built to get people from their suburban homes to work in the office towers in downtown San Francisco. And it works really well for that. But it's an extremely expensive network. It's the most expensive per mile rail system that we have in the country. And so in order to keep BART going, it really sucks the transportation dollars out of other networks that serve lower income communities. And so equity, I think, needs to be built into the transportation system. And the transportation system, I think, needs to serve those who need it the most. So in San Diego, here's some language that's gone into their plan. They've written that you need to locate transit stops to maximize access and optimize transit service and pedestrian and bikeway connections where located near crossroads and major activity centers. Stops should be at a quarter-mile interval. Quarter-mile is about as far as most people will walk between stops, and if you put the stops farther apart, then you render the transit system useless for many, especially for seniors and for children who are not able to walk much further than that. So that's what they've done in San Diego. And by doing this, by focusing on mixed streets, by focusing on a transit network, by focusing on density, you can change places. I'm going to show you a simulation here. This picture is in Palo Alto on El Camino Real, but it could be Blackstone in Fresno. I don't know the streets in Bakersfield as well, but I'm very certain that there are lots of streets in Bakersfield that look just like this. They might look a little bit different, but here you got a 6-lane, what you call arterial, okay? It's not really a neighborhood street right now. It's made from getting from place to place. This all the way from San Jose to San Francisco, El Camino looks exactly like this. There's this one cyclist there, but he's really not meant to be there. He's probably just trying to prove a point or who knows what. You've got businesses, and on the left-hand side you see Warburton Village. That's a senior home, but you don't see any seniors walking around. Warburton Village is set back from the street, and there's a parking lot in front, and this is clearly a neighborhood for cars. That's what it is, okay? So imagine this. You've seen American cities start to do this. You've seen places in the valley start to do this. Turn it from a road more into a place, all right? Trees have gone in to give shade. The sidewalk has gotten wider. There's a bus lane now. There's a bus shelter to give someone somewhere to sit while they're waiting for the bus. And it's a step in the right direction. There's no bike lane yet, but we're getting there. And this is where we need to get. And so you see now what has happened here is the height limit has been adjusted. Whereas before you had I think it was a 3-story height limit, that's what that Warburton Village was. Now you've got a 6 or 7-story height limit. The setbacks have been changed. No longer are you required to set the building back from the road and have parking in front. In fact, you're disallowed from doing that, and the parking has to be in the back. And what this does is creates a whole new streetscape. You've got mixed use now. You've got the commercial, which you had before, and you've got the residential up on top. And so as you walk down the road, what you see are businesses that you may or may not want to go into. And the businesses now actually want to be there. And it's different types of businesses. It's not the car wash that you saw before, but it's shops, it's stores, it's restaurants. And they want to be there because they have all these people living right there, living right on top. Supermarkets. What you're starting to see in places, Palo Alto is a little bit behind, but in certain other places, are mixed-use developments with a supermarket on the bottom and residences on top, and especially if seniors are involved, you'll have the elevator go straight down into the supermarket, and the supermarkets love that because their clients have very easy access to them irrespective of the weather. So what was just a road has been turned into a community. And let me just give you one more fact about transit. With many more people living there per acre with much more population density, you can support much more frequent bus service. So instead of say 20 people an hour wanting to take the bus, you now have 200 people an hour wanting to take the bus. So the transit system is going to run many more buses down that line. That makes transit more of an option for everybody because instead of being late to where you want to go, you can now be on time or even early because there's much more frequent service, because there's much more demand. It's a virtuous circle. So I also want to talk a little bit about injury because that's a big thing. As places are starting to focus on infill development, the potential for injury, especially for children, is a big one. The most recent research that I'm aware of, which is just a little bit more than 2 years old, shows that the overwhelming majority of American children do not walk or ride to school. It's 87% of American children are driven to school either in a school bus or in a car every day. That leaves 13% who walk or ride to school. And among those, that includes those who do it infrequently. So, the overwhelming number of American kids do not walk to school anymore. And one of the two main reasons is fear of injury. Parents are worried that their child will be hit by a truck or a car or something like that on the way to school. And actually, the most dangerous place, the place where the kid is most likely to be injured, is right around the school by other parents who are dropping or picking their kids up and trying to do it quickly because they're in a rush to get to work or whatever. Design standards can do a lot to change that. Children are 13 times more likely to be injured on a street that looks like the one in the top, where, as you see, there are no sidewalks at all, than the one in the bottom, where it's a narrower street. This one has a median. It's got a sidewalk. It's very simple. If you get people off the street, you get walkers off the street, you provide cyclists with a dedicated lane, they're going to be safer. They are less likely to be hit, and parents will feel safer letting their children use that. This is the sort of hallmark of a complete street, a street that is built for all modes of transit. In these times, and in fact all times, this is equally important consideration to keep in mind as well, which is that what we are finding, what researchers, this one is from the Political Economy Research Institute at UMass Amherst, and they did a study that was published in 2011, Pedestrian and Bicycle Infrastructure, National Study of Employment Impacts, showed that when you spend $1 million on an infrastructure project, a road-only project actually has the least bang for its buck. And if you are looking at your local infrastructure spending as an economic stimulus approach, by spending on multi-use trails, pedestrian projects, or cycling projects, you're going to generate more local jobs per $1 million spent than if you spend on roads only. So it has a multiple benefit here. Healthy not only for the individuals, but healthy for the local economy. So these complete streets, remember, multimodal transportation system is important. People need to be able to switch between modes easily. You'll get some people who are willing to walk more distances to get to transit, but others who need to be able to ride their bike to the transit, put it on a rack on the front of the bus, get off and be able to get to their car or hop in another mode quickly. It is critical to design for comfort and safety. Otherwise, people are not going to use it. And what we also see works well is to factor in incremental change. If you listen to everything I've been talking about today, for many American places, this is a huge change. This is a huge step forward. And people resist that sort of thing, and people are uncertain about the viability of some of these steps. And frankly, the steps work differently in different places, and so it needs to be factored in incrementally. That's something a lot of us advocates have to keep in mind all the time, to be factored in incrementally. From St. Louis, here's what they've said. They've said in their plan that as a matter of standard practice, the transportation system should be designed, built, and maintained in a manner that accommodates not only automobiles, but transit vehicles and non-motorized modes of travel as well. I would be remiss if I didn't talk about Parks and Rec, because activity and physical activity as part of daily life is not just about walking or biking or to the bus or to work or to school. It's about recreational activities and having access to recreational activities. Too many places in this state and in this country are underserved by those. There are too many neighborhoods where parks are too far away. That quarter-mile distance is a critical one, not just for the spacing of transit stops, but for park access as well. And in your plan, in your recreation section of your plan, there's opportunity for talking about access and proximity. There's opportunity for setting open space requirements. There are cities around the country now that are setting requirements for minimum open space. And as new developments are approved, the developers are assigned impact fees, which are used to pay for construction of new open space or new recreation facilities, or to pay for land acquisition, or to enhance existing open space or recreation facilities. And people have realized in some places, is still learning in others, the need to plan for different cultural and lifestyle preferences. Your town might be a town in which what is really needed is a tennis court. Or it might not. It might be one in which you really need a skateboard park. Or it might not. So there's no one-size-fits-all. There might need to be place for the ballet folklorico. And so involving the public so that you can plan for culturally and lifestyle appropriate physical activity and spaces, I think, is a critical part of the strategies of planning for parks and recreation. In Montgomery, Alabama, what they've decided is that within 1,000 feet of every residential lot, a civic space designed and equipped as a playground shall be provided. Okay. In St. Petersburg, Florida, what's going on there, that's in Pinellas County, is the mayor has decided he has launched what he calls a Playing Close to Home initiative. And there needs to be a park within a quarter mile of every house. And the park doesn't have to be something big and elaborate. I happen to live near Golden Gate Park, so that's 1,000 acres, but the park could be half an acre with a tennis court and swings and slides and a dog run, but there needs to be somewhere where people of all ages can go and be physically active. And one of the strategies that's being used all across the country, and I think needs to be used a lot more, for providing access to parks and recreation and for other civic spaces, is shared use. Some of you are probably familiar with the term joint use, and that's a term that we've used time and time again, increasingly across the country. I'm starting to see people move to the phrase shared use, so we're using it here. And shared use of civic and other public and sometimes religious facilities. It has long been a strategy in many American places. It's a strategy that some places got away from during the last couple decades, but that they're now getting back to. It's a way of having public organizations, schools, libraries, YMCAs, boys and girls clubs, churches, collaborate to ensure that the public has maximum access to the facilities for a wide range of use. It's good for the public, it's good for the civic budget, and it's good for the organizations involved because it helps them build partnerships. It helps them find friends. It gets them access to resources that they wouldn't have had otherwise. And it enables neighborhoods to be more complete than they would have otherwise. So there are different strategies for shared use. I know Avatar herself has been involved in trying to open the gates of facilities, recreation facilities, so that others can use it. In a lot of neighborhoods, the focus is on opening the gates to the school grounds after school and on weekends so that people have somewhere to go and play and run around. Sometimes it might be opening the gates to a recreation facility during lunchtime so office workers can go and use the facilities. It can be more complex. In a lot of places now, you're seeing design and construction of shared use spaces. In San Jose, San Jose State and the city of San Jose and the Unified School District all together built a new library right downtown. They designed and constructed that together. So it's the main lending library. They've got a big kids section, but it's also a research library. In Texas, they've gone very far on the joint use of libraries on high school facilities, and so those are the main town libraries now. This is a way that they've avoided the typical round of library closures and limited hours when you're in economic hard times, because they've sort of starting to get rid of standalone libraries and building them into high schools, because what they find is the partnership between the library district and the schools is a mutually beneficial partnership for both of the institutions and for the public. And you're starting to see that move across a number of realms. Of course, access to places for physical activity has long been, and I think will continue to be, one of the major focuses of shared use. But people are also looking at access to land on school property and other underutilized parcels of public and private land to see if those can be used for community gardens. People are starting to look at church kitchens and school kitchens and to see what sort of shared use agreements can be crafted between different partner organizations so that institutions and public feeding programs and others can have access to those facilities. And so through the use of the shared use agreement, and we've got a lot of those model agreements. I don't know if Livia might be able to find some of them and put them up in the chat box. But through the use of those agreements, we're really starting to see a lot of progress being made around the country in forming mutually beneficial partnerships for public benefit and for the benefit of the institutions involved. And I think that's really one of the things that I want to emphasize about this planning for healthy places approach, is that when we're planning for healthy places, we're obviously planning for the physical health of the residents who live in those places. But we are, if we do this well, planning for the economic and political health of the participating and enabling institutions. Health can be defined in a number of ways, and economic vitality is central to a healthy city and to a healthy place, because these things need to be sustainable, and so we've got to ensure that they're sustainable across the full definition of the word sustainable. So give you an example here from Pasco, Washington, small town. We have as many small town examples as possible to show you that this work is happening across the country in a real diverse range of places. Here, the city and school district have decided they shall jointly develop and operate school playground and park facilities in order to economically meet the needs for neighborhood parks and improve school facilities. This just makes sense. Pasco is like Spokane. Spokane in eastern Washington claims to have the oldest joint use agreement in the country from 1932 between Parks and Rec and the schools. And when I was up there, I was really fascinated to learn that Spokane Parks and Recreation, all through the winter, during the bad snowy weather, has basketball leagues and all other sorts of indoor programs, but they themselves don't own any indoor facilities. And the Spokane School District, all through the good weather, has football and baseball and all those other sorts of outdoor activities, but they themselves don't own any outdoor facilities. What they do is they co-locate and they build right next to each other, and the Parks and Recreation Department uses school indoor facilities, and the school district uses Parks and Recreation outdoor facilities, and they've been doing that since 1932. And the reason they do that is they find it's a more efficient use of public money, and it enables them to provide a lot more for the people of Spokane than they would be able to do otherwise. And so that's why they do that. And to me, that's just common sense. And slowly but surely, that sort of common sense is, again, becoming the norm across the country. It requires a lot of working together. It requires compromise. It requires give and take. It requires written agreements in many cases. In Spokane, for 50 years, it worked on the basis of a handshake, but for a number of reasons, they decided that they needed a written agreement, which is great. And the written agreements get revisited time and again. I've seen places where the written agreements get revisited every 5 years. I've seen places where the written agreements get revisited every 2 years. I've seen places where they get revisited every year. I think that's a little bit too often. But at the basis, it's a relationship, and it's a relationship that gets maintained through hard work because it's in everyone's interest and it's in the public's interest, and people have decided that they need to work for the public good and for the health of the public. And so let me just talk a little bit about resources, because for those of you who are out there trying to do this work, there is no need to reinvent the wheel. There is somebody somewhere doing what you're interested in doing, and we can help you with that. We have a lot of model resources here on our website, changelabsolutions.org, or if you want to go to our old one, phlpnet.org, it'll redirect you. We've got toolkits and other things. This one, How to Create and Implement Healthy General Plans, contains a lot of what I was talking about today. And one of the advantages of this is there's language in there that you can use and plug right into a plan update. We like to do that. We like to have as much plug-and-play language as possible. And if you look into the chat section, you'll see a bunch of links that have been put in there. Getting involved in transportation planning, model language for complete streets. We've got a new one, creating healthier suburbs. A lot of these, the joint use checklist, have language that's plug and play and that can be put right into your general plan update. And so I want to stop right there. We have we also have legal analyses as well. And so NPlan, which is part of us, has done legal analyses of a lot of these proposed infrastructure and other planning-related changes. The city attorney is often a skeptic, or the school attorney is often a skeptic when you come at them with a proposed new way of doing things. And that's fine. That's their job. Their job is to protect their client, which in this case is the town or the school, from potential liability. And so what we've done is we've done the analysis to show the reality of the problem, if there is indeed a problem at all. And then we tailor our agreements and our model language and our model ordinances to make sure that whatever the potential legal problem is minimized, if not gotten rid of altogether. So that's me. That's how to get in touch with me. And I'm done, and maybe we can take questions. A question here, and I'm going to start it off because that's just how I am. Please explain what how you have been involved in plan update processes in your community.
I'll start off. So Robert, for us, and a lot of the plan process has been working with our local city, county planners, current COG. We've been working with residents, outreach, really having community outreach to get the input about what it is they'd like to see in the general plan. And what usually happens is general plans is such a vague term to many people on the ground if you're not doing this kind of work. So it starts off of kind of talking about, where you live, how you live, homes, stores, access to services. So it becomes kind of that 101 training that we've done in the past.
Mm-hmm. So that's what you've done?
Yeah, we've done this process now, and what's led out to it has also been health elements, which is wasn't required at one time, but I think it's now becoming a required piece to deal with some legislation that came into place, the SB 375 and AB 32.
So explain to people what a health element is, how you guys are doing that.
So in Arvin, what we did with the health element, we had the 7 designated chapters, but we looked at aspects of how
of your general plan, right? Sorry,
yeah, of your general plan.
Chapter.
Yeah,
so
the 7
the
designated
law,
elements.
The state law mandates that all general plans have certain elements. An element is a planner word for chapter. So there's certain chapters that have to be in every plan. Sorry, go on.
So in Arvin, what we did was we also looked at how do we address AB 32, which is, I believe, the greenhouse gas emissions, and SB 375, the sustainability, and tie that in with land use, housing, and transportation, which were the required pieces of the general plan, but as well as tackle that issue through air quality and health. And we did a health element for the city of Arvin, and in which we had a diverse committee, those who represent different aspects of Arvin, from the chamber, from the businesses, which is chamber, from, if we could, the medical community, schools, public health, and looked at several policies that either were already written and existed, for example, tobacco ordinances and what was existing around no smoking in parks, or a zone where you could have just a smoke-free smoke zone, but other areas. And we looked at, access to locally grown produce and community gardens as one of them. We also looked at medical services. We also wrote some policies around transportation, but which included complete streets and not all aspects. So all these different areas that tie into health were written into the health element, which were then adopted by the Planning Commission.
Got it. Well, that's great. So right now, the law in California does not mandate a health element, but health elements are becoming more popular. The people in Sacramento who oversee general planning is the Office of Planning and Research, and that's part of the governor's office. And there is a pretty strong desire among the OPR staff to not increase what people see as unfunded mandates on the localities. Nonetheless, organizations like ours and others have been making the case to a lot of localities that, the sort of work which is going on in Arvin is good for the locality. It has a lot of benefits, and they're starting to pick up on that. And so what we're actually doing right now with OPR is we're writing new guidance language to send out to all the planning agencies around the state on different ways that they can incorporate health into their general plans, and on what some of the best practices are, which is different than mandating, but that's, this is becoming a new norm, and we're seeking to help institutionalize it across the state. And so what you guys done in Arvin is really quite innovative, because you have taken the general plan process and used it as a way to deal with some of these other pieces of related legislation.
Yeah, and we're doing that in Delano next. So I know that it's not required, but it seems like several of the cities or the planners are looking at that as a way to address the AB 32, SB 375 legislation.
That's correct.
Not the only way, but it seems to be one of the ways.
One way, yeah, exactly. So AB 32, for those of you who are not familiar, was legislation passed a couple of years ago, which has set emissions goals. The goal is for the state of California by 2020 to have reduced the amount of greenhouse gas emissions back to 1990 levels, and by 2050 to be, I'm trying to remember what it is, I think it's 50% below 1990 levels. So that's what AB 32 is. As a way of getting there, SB 375 was passed. And what SB 375 is going to do is try and compel regions to adopt plans that reduce vehicle miles traveled by doing more infill, more mixed use, and more transit-oriented development. And if places don't do that, the state will not release transportation funding to them. So that's AB 32 and SB 375. And what Arvin has done is use their general plan update process as a way of setting the ground for ensuring that they meet those targets. And that, I think, is very smart. There was a question from Lourdes Perez about, do we provide TA to modify existing joint use agreements between cities and school districts? And I wrote to her, yes, we can do that, but to get in touch with me to discuss details. How we work in different places depends on how we're funded to work in those places. So sometimes we've got foundation funding, usually from the California Endowment or Kaiser, to do the work. Other times we would have to negotiate an agreement with the place. So get in touch with me, Lourdes, and we will see what we can do. Thanks, Aptar. I appreciate that. Aptar is certainly one of the leaders around the state in healthy planning from the public health department perspective. So she's a wealth of knowledge.
Participants will be receiving an email tomorrow morning that will have a link that will have not only today's webinar recording, but also a very comprehensive list of all of the resources that Robert mentioned on everything from complete streets to transportation, livable communities, and joint use agreements.
Yeah, and you should feel free to browse our website. We've got a pretty good search function. So if you're interested in a particular issue like joint use or healthy transportation, you'll be able to find a lot of stuff there.
Excellent. Well, thank you very much, Robert, and thank you, Aptar, and thank you to all of the participants for making it to today's webinar.
Thank you, everybody.
Thank you all.
Bye.
Bye.